Ladies, let's talk about a topic that's important for us: cancer screening for women. The first question is, why should we care about cancer screening? The goal of cancer screening is to detect cancer in its early stages when it's more treatable and easier to get rid of. This means we do certain tests to look for cancer in the body, even when we don't have any symptoms. This is because when cancer starts, it silently grows in the body without any notice, and by the time symptoms appear, the cancer may have reached an advanced stage. Different stages of life bring different risks, so the next question is, when do we start screening tests, and which cancers should we screen for? There may be slight differences in recommendations by different agencies. Here, we are mostly going to share the recommendations suggested by the United States Preventive Services Task Force. First up, at age 21, it's time to kick off cervical cancer screening. It's like a checkup for your cervix. Cervical cancer screening includes a pap smear. A sample of cells is taken and viewed under a microscope to see if there's any abnormal cells that suggest cancer or abnormality. This test is repeated every 3 years. Jump to age 30. You can now choose to add a test for human papillomavirus or HPV to the pap smear. HPV is a sneaky virus that is sexually transmitted and can cause cervical cancer. If you do HPV test and a pap smear together, then you can repeat the test every 5 years instead of 3 years. By age 65, if your previous tests have been normal, then you can stop testing for cervical cancer screening. There is also a vaccine available against HPV that can reduce the risk of cervical cancer. Now, we're turning a new leaf at age 40 with screening for breast cancer, the most common cancer in women. Breast cancer screening is performed by doing a mammogram, which is a special x-ray of the breast to look for any abnormal areas that could be suspicious for cancer. Generally, it's recommended to do a mammogram every 2 years until the age of 75. However, make sure to discuss with your doctor about test intervals and other ways of testing that may be better for you. Now, we move on to age 45. That's when we start screening for colon cancer, another common cancer that can hide without us knowing. There are different tests that can be used for colon cancer screening. The most accurate test is a colonoscopy, a visual exploration of the colon using a camera on a flexible tube. If the results are normal, then a colonoscopy is repeated every 10 years. If colonoscopy isn't your preferred way of testing, there are other ways to screen for colon cancer using stool tests. These tests look for hidden blood cells and DNA in the stool. There are a few different types of tests available, so discuss with your doctor to see which ones are available and appropriate for you. If the result of the test is not normal, then you may need a colonoscopy. You can consider stopping colon cancer screening at the age of 75 years. Moving on to the golden age of 50. This is a time for lung cancer screening. Lung cancer screening is only for those who have smoked for 20 or more pack years and currently smoke or had been smoking within the past 15 years. If you qualify for lung cancer screening, then you need a simple low-dose CT scan of your chest every year to look for any abnormal spots that may be cancer. The screening test can be stopped when you turn 80 or when it has been 15 years since you stopped smoking. Remember, all of these cancer screening tests are intended when you do not have any symptoms. And if any of these tests show an abnormal result, that does not always mean it's cancer. It will need further testing and investigation as recommended by your doctor. It may feel stressful to have these screening tests, but it's better than the stress of having a cancer that could have been cured earlier. So chat with your doctor. They'll guide you in understanding your personal cancer risk, how to perform screening, and whether additional tests are needed. Ladies, let's take charge of our health, one screening at a time, and plan for a happy, healthy life ahead. Stay healthy and help others stay healthy.